Okay, this is how you submit a claim. You need to know some things. Let's go into the MyHR Connect section of your city account. You'll see it load up. Click on My Pay. This is important because we're looking for our last pay advice. That's going to give us our most premium paid. We'll do that through the View Detailed Paychecks. You'll see some checks. Choose the latest one or the last one of the year. That's the best one. Click on your pay advice. You'll see a few relevant pieces of data. I've made arrows of what you need. Everything else has been blurred out, and you can black that out for later reference. Notice the values. Let's move on to a version that I've highlighted, and that would be submitted to Greenshield. If they ask, they'd submit this version, everything highlighted, everything blacked out. So we log into Greenshield Canada. Do it as a plan member. Know your password. Stop if you don't know this. You'll get logged in. There's a few ways of getting through this claim process. You can click on Your Claims, submit a claim, type in health. It will clearly show a health spending account, non-taxable HSA. Select the type of claim as health and dental plan premiums. Or, this is how you'll get there. Or you can click on your name in the top right, your GSC account. Click on your coverage, then health and spending account. We're in the same location as we were before, except now we know how much we have. We have 300 given, 107 used, and I have 192.33 that I need to claim through some sort of process. I don't have any drugs to buy, so I'm going to use my premiums. So we select the claim again, health and dental plan premiums. We're back to where we started in the first bit. So select your name. This is important. Select yourself. This is not your loved ones or your kids. The provider's name is the City of Calgary. The phone number I put as the HR number, 268-5800. Feel free to fill that in however you wish. The PO box is 2100 Station M, 8107 CP, Calgary, Alberta, T2P 2M5. Now, it's important to have all of this information in, because if there is a flag and you submit based on a claim problem, they'll be able to see that it's your pay advice. The date of the pay advice we'll get to in a second. But the PO box in the City of Calgary is an appropriate thing to place. Now, I'm trying to select November 3rd on this video, but it's November 2nd today, and this pay advice is coming out tomorrow. I would have done this tomorrow if that was easier for my video referencing, but I'll select November 2nd. Just to make this work. Your total amount should be in the after-tax deductions. So I have one line, dental level 3 at $690.80 and extended health level 2 at $242. I can do this one of two ways. I can fill in two expense details, one of each value. I'm paying this, no other carrier is paying it. That's why it's $0, and the selected provider is the City of Calgary. Now, you can do it this way. It's just as easy. You see how fast I'm doing this. Feel free to pause this and figure out what I'm doing. Or we can just get out of this and take away the two expense details, combine the extended health level 2 and the dental level 3, and that should give me a value that I'll put in the total amount. Again, I'm paying it. No one else is. The City of Calgary is the provider. We click on next step after we're sure that we have the right value. I used a calculator just to make sure. Next step. This is important. Review what you just wrote down. So it's a health and dental plan premium claim. Your member name is correct. Phone number, PO box, all the provider name is good. Your expense date, that should say November 3rd, not 2nd, because that's what the advice says, the total amount. This confirmation is important. Don't ignore it. The confirmation is saying that you are telling the truth, that you're not committing fraud, and that if you're asked for an audit, you will participate. And you have to, according to your own benefit plan and how that is written. You'll then click the submit button. That's it. That's all you got to do. You're done. Congratulations. Way to go. That wasn't hard. But if you have any questions, please just pause the video, go back to it, go back over and over and over. It's a really easy process. In 4 minutes, I can make you up to $300 of your own money that you paid in premiums to the provider. Now, you may not have spent that much money in premiums. That's okay. You can only collect what you can. But if you have more, let's say in my case, I had more than my plan premiums, my health spending account could cover, What happened in the past was that all that remaining money would come off in the next year's health spending account. I'm not sure if that's going to happen anymore. I didn't see the checkbox in the new website design that makes that happen. But it used to automatically. Many people who use their health and dental premiums to the max never have a health spending account, and they use their premiums to offset that cost by getting that extra $300 in. Hope this was helpful. That was under 5 minutes.